sponsors. So welcome everyone. My name is Dr. Juliet Ophia, and today is the second edition of ADHD Awareness Series. Today we'll be focusing on the parents, okay? We have a lot in store for you. We have two amazing consultant psychiatrists that will be here talking about today's topic, okay? About ADHD. ADHD means attention deficit hyperactivity disorder. Okay, we talked a lot about it and we taught a lot of teachers coping mechanisms in the classroom, but today we are focusing on coping mechanisms for parents. This program was proudly, supported by Lagos State Ministry of Health, also by Janssen Pharmaceuticals, and also by Mind Trust NGO. We are also supported by the Association for Child and Adolescent Psychiatrists and Allied Professionals of Nigeria. So you can see the powerful bodies that are behind this presentation. So moving swiftly on to our presenter for today, okay? Let me make sure I pin him up. Good. So today we have a consultant psychiatrist, okay, from the University of Ilorin Teaching Hospital, Kwara State. That's where he went. He is a consultant that is passionate for families as exemplified by his role as a child and adolescent mental health specialist, as well as his research interest, which extends to women's health. He is currently a core executive member of the Association for Child and Adolescent Psychiatry and Allied Professionals in Nigeria, where he also serves as the major content developer for the social media arm of the association. You can see that we doctors are very, very social media oriented now. He has taken up similar roles in his local hospital, where he now serves as the public relations officer of the University of Ilorin Teaching Hospital, branch of the Medical and Dental Associations, Consultants Associations of Nigeria. He teaches medical, nursing, and psychology students and engages the public on mental health matters through radio programs and social media, okay? He's the founder of Yours Mindful Official, a mental health initiative with active presence on social media platforms. He's much sought after, okay, as a public speaker, and he really inspires us all. His name is Dr. Ayotunde Omotosho. Welcome, sir. I hope you can hear me.
Yes, absolutely. I can hear you. And I heard your kind words. Thank you very much. Awesome.
So feel free to control the slide. We need to see your picture.
Yeah. So hopefully the one you have pinned is the one that has my picture on it.
Yes, it has your picture on it.
Okay, beautiful. So I'll just find my slides now so that we can jump straight into the conversation.
If you need me to help you with the slides, let me know.
Okay, just a moment.
Okay.
I'll have the answer to that in no more than no more than 75 seconds.
Okay, cool.
Yes.
In the meantime, I want to know where everybody is listening from. Where are you listening from? Let us know. Are you in Lagos? Are you outside Lagos? Let us know where you are listening in from. I know a lot of you are, in Lagos, but last time Lagos, Marianne is in Lagos. So, okay, a lot of people from Lagos, Sarah. Okay, Ogun State, nice. Enugu, interesting. Wow, United Kingdom, Bayelsa. Thank you so much for logging in, Bayelsa. Thank you, Kende Adedeji from Ogun State. Oh, nice. I hope you guys invited others to be here, because this is something that you don't want to enjoy and gain by yourself. Okay, we have people from Abuja. Okay, presently outside Lagos. Okay, I see that. Chichi, Ogun State, nice. A lot of Abuja, Ogun State, Enugu, or many. Juliet, my namesake, welcome. We're going to have an amazing time. And I'm sure the people that came in, the last time had a wonderful time as well. So we look forward to what we are going to gain today from our consultants. We're starting off with Dr. Ayotunde Omotosho, and he has something very brilliant. He's no stranger to these kind of platforms, so we are going to have an amazing time. And yes, we've received all your questions, and we can't wait to answer all of them. All right, I think we're good to go.
Yes, I believe we are, and I want to know if you can hear me.
We can, but we don't see you.
Okay, that was going to be my next question. Can you see me?
We see you now. Okay, let me remove this.
Okay, so right now, I believe you can see me.
Yes, we can.
Yeah,
please type on Y if you can
I see me. So what did you say?
I said they should type a Y if they can see you and if they can see the slide.
Absolutely, yes. So I see a Y from Joseph. I see a Y from Esther. Beautiful. Okay, I see lots of Ys now, and I think that's my cue to begin right away. So thank you very much, Dr. Jules, for the very warm introduction. Regardless of what the weather is, wherever you're joining from, I'm sure you'd agree with me that that was very warm. So thank you, as has been said, and as you can hopefully see on your screen, my name is Ayotunde Omotosho, and my global practice is off of Ilorin, Nigeria. And today we'll be talking about ADHD. If you joined us at the party yesterday, I'm sure you had a blast because we talked about ADHD. And the main focus yesterday was essentially on how it relates to teachers. But today we're going to tweak it a little bit. And the focus today is going to be on parents. But before we even have that engagement with parents all over the world, I see people joining from Lagos and different places. We're going to understand, first of all, what is ADHD, so that by the time we begin to talk about what to do about it, we would have started by contextualizing it. So to answer that question, what is ADHD? Okay, so just a moment. I'm sure that this should move in just a bit. Okay. So I hope you can see this.
Yes, I can.
All right, beautiful.
I hope everybody else can.
Okay, wonderful. So it means that we can go on then, because this is how we're going to describe it. We'll first of all start with an introduction. We'll talk about the things that cause ADHD. We'll understand what ADHD itself is, which is what doctors would refer to as diagnosis. We'll talk about what ADHD is not, so that we would understand the difference. And then again, because ADHD has many cousins that we should be familiar with. But generally, not to worry, the language here will be user-friendly. We understand that we're talking to parents, many of whom are interested in this because it relates to child mental health. And then what now has to do with, okay, so I know a child, or I have a child that has ADHD, what do I do? And of course, I wouldn't be delving so much into that because the next presenter will do that. So I'm simply setting the backdrop so that we understand what we're talking about today. And of course, I'll end by concluding. So what is ADHD? And if you know what it is, or you think you know what it is, or maybe you were here yesterday, feel free to use the chat room, tell the others what you understand by ADHD. Of course, ADHD is short for Attention Deficit Hyperactivity Disorder. And I'd like to mention a quick story that everybody is familiar with. You know, just a couple of days ago, someone broke the internet because she broke a world record. And incidentally and apparently, she broke a record that she had set. So she broke the world record and then broke her own record. And then, of course, that broke the internet. You know who I'm talking about already, Toby Amusan, that the commentator was referring to as Amazon. And I dare say he was right, because she was an Amazon right there on the track. Guess what? When she was a child, she did a lot of running. In fact, she mentioned on public space that her dad burnt all of her gear because he didn't like the fact that she was always running. But today, the rest is history because she has made history. So I'm asking the question, that child in your house that runs a lot, is that child an Olympian in the making? Is that gifted running? is that normal running that happens with children just because children love to play? Or is that ADHD? Is that something that you should be concerned about? That and more would be what today's presentations as a whole would answer. So that said, let's look at an official definition of ADHD. All right, so ADHD officially, as described by the Diagnostic Statistical Manual, that's what we use professionally to describe all of the disorders that we have in psychiatry or for mental disorders. I see that Ngozi has gone ahead to describe what attention deficit hyperactivity disorder is. So together, let's focus on what ADHD is. And thank you for that spotlight. The view from here is very good. All right, so ADHD is a neurodevelopmental disorder that is defined by impairing levels of inattention, disorganization, and or hyperactivity, impulsivity. So those are big terms that we're going to break down in just a moment. And this is probably the most complex slide that we're going to have. So not to worry. Inattention and disorganization entail inability to stay on task, seeming not to listen. I imagine that someone joining us from Lagos is already thinking of a child that they would rather describe as Aigboron. Okay, so seeming not to listen, losing materials, they probably will call this APA, at levels that are inconsistent with age or developmental level. So whether or not this is something we should stigmatize, we're about to find out. What are these symptoms? Remember, we said we were going to break it down. What is hyperactivity? That's what happens when you can't sit still. So you see some children, they're so fidgety, they're so restless, they can hardly sit still. Now, at home, this may not be so obvious, but the moment you translate it to the school environment or an environment that is supposed to be organized, say a religious setting like church, where everybody is supposed to sit still, you see that this child is just squirming in their sit, finding it extremely difficult to sit. They can't sit still. They find an excuse to get up. That's what's described as ants and pants. It just seems like, you know, how people would say, "Un jala raje." Okay, so it appears that that child can sit still and there's persistent play. In fact, the description is apt when others look at that child and say it appears as though he or she has a battery in them. When other children are tired of playing, when they're exhausted, this child just goes on as though there's a battery that's driving him. Impulsivity is another block of symptoms. All these blocks are umbrellas. There are three major categories. And under hyperactivity, many different symptoms that simply describe the fact that the child's activity levels are way beyond what you would describe as normal. Impulsivity means that they answer questions before they are called. They blurt out. It appears that they act before they process the information, and they can't wait their turn. They can't stand on a queue. They butt into conversations, and you can begin to imagine that these children may not exactly be described as socially adept, because some of the social cues and etiquette that are age appropriate and culture sensitive, you may not see so much of those children doing. Inattention is another major one to pay attention to. And that's what happens when I've described this using alliteration. They all start with D, just so you can remember. Daydreaming, disorganization, distraction. Children who are distracted obviously will forget things. They would not do mental tasks. If they're given assignments in school, they would not do it, not because they don't want to, but because they sincerely forgot. So they will take it home, but then they may not bring it back to school, or they may bring it back unanswered, which should be differentiated from a child that is lazy or a child that is evading tasks. And that's why we should learn about this triad of ADHD so that we do not stigmatize children who have attention deficit hyperactivity disorder. There are actually three different types. There's the hyperactive type or the impulsive type. That's like, think of that as the hyper type. to use a lay term, it means that they're overly active, they're always running around, or they're always impulsive, butting into other people's conversations and play. You imagine that other children may not want to play with that child and all of that. And then there's the combined type that combines the different types together, and there's the inattentive type. For the inattentive type, many people miss it because this child is not hyperactive. This child is not running around. This child does not have high energy levels that you will see in an overt sense. This child is simply inattentive. So the child is attending a class. The teacher is speaking, but the child has gone. The child is not there. The child may simply sight a bird outside, and that's it. From the bird, the child begins to think about an eagle. From the eagle, the child begins to think of high flyers. From there, begins to think about things in the sky. From there, the sky is blue. From there, what other things are blue? The ocean is blue. That child is no longer in that class. So the inattentive type is a type that we should also be attentive to. So how common exactly is ADHD? I've seen people mention things like, oh, child mental illness. Is there any such thing? I've even heard professionals, including medical professionals, say, really, is there such a thing as child mental health? I've even seen mental health professionals wonder if there's such a thing as, say, infant mental health or perinatal mental health. They wonder my resident is also there. We had a child mental health clinic today, and a 12-year-old girl walked in, and what she had at the end of the day was ADHD. It's actually the most commonly diagnosed disorder of behavioral setting in childhood. 1 in 20 globally, that's huge, and it affects 1 to 5% of school-age children. Some would even say 10%. You know what that means? That means 10 out of every 100 children. That means if you have a school of 1,000, I was in a school setting today, they were having their graduation ceremony for toddlers, and I wondered why they would call that graduation. That's not what we are used to as graduation. But imagine if that school had 1,000 people. It meant that from this prevalence we're seeing, it's possible that up until about 100 children, if we look at 1 to 5, that would be 10 to 50 out of those 1,000 children may indeed have ADHD. So you see, it's common, and it's quite common amongst males particularly. So
Okay. You broke off for a moment there. Can we hear Dr.
when I saw a female have ADHD today,
Okay,
but not
start.
as commonly as
Okay.
boys do. As medical people would say, the etiology. I wouldn't.
Okay, I think we lost him for a moment there. Can you guys see Dr. Omotosho? Y for yes, N for no. Yes, no. Okay, okay. I'm sure he'll be back shortly. He has another device connected, so let me put that up really quick. Dr. Omotosho, are you there? Are you there? We can't
Yes,
see.
I'm going to turn it on right away.
Okay.
I just needed to make sure that we were on the same page in the most literal sense. Same PowerPoint page.
Awesome.
Okay, so you can see me, you can hear me, and you can see the slides, right?
If you can see Dr. Omotosho, please type a Y. If you can see and hear, 2 Ys, Y. 2 Ys, I can see, I can hear. Perfect. We are good to go, sir.
Okay, thank you very much. You're far too kind. So the risk factors, there are known risk factors of ADHD. The fact that the cause is unknown does not mean that science does not know anything about the origin of ADHD. Okay, so there are risk factors that are known. The meaning of risk factors is that if somebody has these characteristics, they are more likely than other people who don't have those characteristics to develop ADHD. I hope you understand that. I think I'm beginning to like this why. So use why if you understand it. All right, so the risk factors include the male gender. So it's commoner in boys, like I mentioned, in fact, 3 times commoner in boys. And if there's a family history of ADHD, it's commoner. If you were at yesterday's party, you would have remembered Dr. Atilola's comments about this, that many times when we see clients or patients at the clinic and we begin to say, oh, my apologies, I hope you can hear and see me better now. I saw the feedback in the chat room. All right, so I'll move on in the hope that you can hear me and you can see me.
Yes, it's quite stable from my point, but it's okay. Thank you so much for the feedback.
Okay, beautiful, beautiful. Thank you very much. So if there's a family history, what that means is sometimes you're asking a parent, a father, about a boy who has ADHD, and you ask a certain question, and the father thinks and says, yes, that's a yes for my boy, and that's also a yes for me. So it runs in families. And when there's premature birth, it may also occur more commonly when the birth weight of the baby is lower than what is usual, when the mother was drinking alcohol in pregnancy, it may predispose that child to ADHD. And then there are some other brain conditions that may also predispose to ADHD. And the general rule is that the risk factors for ADHD are generally biological. If you remember from yesterday as well, Dr. Bello Mojid mentioned this, that generally for mental disorders, there are 3 blocks, as we will see in the middle of this conversation: a biological aspect, a psychological aspect, and a social aspect. But for ADHD, it's predominantly biological because the story is told by the brain, the frontal part of the brain. It means the foremost part of the brain is implicated in the development of ADHD. And that brings me to the story of Phineas Gage. He was a man who lived in the early 20th century. You know that period was marked by railway jobs. Today we talk about remote jobs, but what was reigning at that time were the railway jobs. It was the period of the American Revolution and all of that, and industrialization and railways. And he had an accident to his head. You see that rod he's holding in this slide? That rod actually slid through his skull and came all the way out. So imagine that it lacerated his brain and went out. I don't want to describe it in more gory ways, but he actually lived to tell the story. And what people realized was that this man, who hitherto was very gentlemanly and would often use the right kind of words, became someone who would use profanities. He began to use swear words, and they realized that, wait a minute. And then he also had prefrontal cortex dysfunction, which is what is central to ADHD. These were the beginnings of the understanding of how the brain worked and how specific parts of the brain were responsible for specific disorders of the brain. So if you do a picture, there are some pictures that we take, and we take pictures of the brain, and those pictures also show us that that frontal part of the brain is affected in ADHD. I'm mentioning this so that we will understand that if a child has ADHD, you don't try to talk the child out of it. It's a disorder. So if you see parents of children who have ADHD, chances are that they may have also been hyperactive when they were children. And when you look at twins, you see that many twins, if you see a twin with ADHD, particularly if they're identical twins, the other twin is also likely to have ADHD. So you see that it has a strong genetic basis. And there's a mix of factors, but it's mostly biological. And that's what this is also showing us, is simply using more complex language to describe what we all in this Zoom call already understand. Now to the meat of the matter, how exactly do we identify ADHD? We've heard about all this brain stuff. We've heard about pictures of the brain taken, and it is the foremost part of the brain that is affected. And by the way, why that is important is that in the same manner, just like we mentioned previously, that it will be wrong to tell a child that can't see that just look at the board, you will see it. You don't need glasses. I mean, we all know that that will be wrong. In the same way, it will be wrong to blame a child with ADHD for the condition and say that, I like Moroyi, or, those things, derogatory things that people may say to such children. And the diagnosis, or the way we know that this is ADHD, is based on the symptoms we see. It's not even based on the causes that we have mentioned, regardless of what they may be. So that's why it's important for us to understand what are some of these symptoms. How can we identify it? Now, you on this Zoom call may not need the information that we use as professionals. What you probably need to know is the fact that when someone has ADHD, it is persistent. So it's not like the child had a sugar rush. The child just took Caprisone or Chivita or some other product. I don't want to name products here. I'm not marketing at the moment. I'm just trying to say it's not like the child took soda. Let me mention something generic. It's not like the child took soda and then had a sugar rush and ran around, or the child met his cousins that he hadn't seen in a while and then they ran around. It would happen persistently for a long time. It will be pervasive. It will be persistent. Pervasive means that it's not just happening in the house because the child is very familiar with the parents. It's also happening in organized settings outside of the home. So that's what you probably need to know. That should be your take home. And the fact that it's based on 3 pillars: hyperactivity that we had discussed, impulsivity, and inattention. And with hyperactivity, the child is fidgety. The play is dangerous. So this is to answer the question we were asking about Toby Amusan and other people who probably were already gifted as children. How you would know that this is not just gifted play, or this is not normal play that you will see in other children, is that this child, the play is dangerous. Remember, the frontal part of the brain is also the one that tells us this is dangerous. Don't cross the road yet. Look left, right, and left again. Is that part that controls it. And that's also the part affected in ADHD. So their play is dangerous. They may stand on the edge of the leaf of a tree. That dangerous. And then their play is noisy, is disruptive, and it is persistent. When other children are tired of playing, they keep going. Then the impulsivity, how can we identify it? They blurt out words. They can't keep quiet. Their speech is copious. They can't wait their turn on a queue to enter the school bus. They can't just wait on a queue to select people that will play in the football match. They can't wait. And so you see that they may not have many friends and all of that. And the inattention means that they can't focus. They miss important signs. They not to be listening. And remember, I mentioned at the beginning of this, and so as we dovetail to the end of this conversation, I'd like to mention that ADHD has a couple of cousins. And if I pinch it out a little more, we will see who those cousins are. These are the cousins of ADHD. One of them is autism, autistic spectrum disorder, as we would call it, just to give it a longer name and surname. With autism, people with autism, and if we have time during the question and answer to take issues of autism, we can talk about that. But in autism, essentially what happens is that they can't quite communicate well with other people, and they can connect socially with other people, and then they also have repetitive behavior. Now, this is different from ADHD, but they may coexist. There's nothing that stops someone that has ADHD from also having some of these other disorders, such as autism, such as a disorder that affects their conduct, and then learning disabilities. The child we saw earlier today, for instance, that had ADHD at our own clinic, also had, unfortunately, intellectual disability and had challenges with school. At age 12, she was still in primary 2. Yes. So you see that that can happen when someone has ADHD. Are there adults that have ADHD? This question was asked yesterday. Yes, and some of them are popular. You may know them. If you know the adults on top here, you may type in the chat room, mention his name if you know him, the one wearing the bowler hat and the designer glasses. Well, the answer is in the question because on the screen, you can see his name, will.i.am from the Black Eyed Peas. He has adult ADHD. He grew with ADHD onto adulthood. And of course, the second person there, do you know his name as well? Okay, I see us typing Y. Type the exact name. His name is Kirk Franklin. He just did a tour with Maverick City and he lives with ADHD. He mentioned, yes, Tosin, you're correct. will.i.am lives with ADHD. He has mentioned this publicly. Kirk Franklin as well. He has mentioned this and he even gave kudos to his teacher who helped him when he was younger. Some of you may have heard about Michael Phelps, the swimmer. Yes, Juliet, you're correct, Kirk Franklin. And you see how they have been able to translate that into their talent. Both of the people here are musicians. Michael Phelps is a swimmer and he won so many Olympic awards. And it was because those who realized that he had ADHD were able to channel those energies into something that was quite extraordinary. Now, my child has ADHD, what now? What do I do? This will be part of the focus of the next conversation that you'll hear by the next speaker. So there are different things that are done for ADHD, such as drugs and psychosocial management, but suffice to say that the focus of this presentation was what exactly is ADHD. And immediately after this, you will learn about what parents can do. I'd like to round off with the food for thought by saying that if a child can learn the way we teach, then perhaps we should teach the way the child can learn. So we can connect as parents and as teachers with children who have ADHD, and certainly there is hope. I thank you very much, participants, for being participatory. Thank you for all the whys that I saw. And that will be the end of this conversation.
That was simply amazing. Please type in an emoji. I see you guys already know the culture on this page. You're already typing emojis. Appreciate Dr. Ayotunde Omotosho. Wow. In short, you know, after this presentation, I'm sure many people will not stop their children from running. No, you are just saying, oh, you're talking about and everything. People will be like, oh, let them run. Doctor told me that they should run and stuff like that. So, I mean, we are super excited. That was very beautiful, very simple. You know, people, I'm sure they all got the information. Thank you so much, Dr. Omotosho. That was quite amazing. And you can see everybody's appreciating, typing all emojis on. Thank you so much. So the flow, we are going to move on swiftly to the next presenter, okay? So it's a two-part thing. So we are going to go to the next presenter, okay? And then we'll be taking your questions. Don't worry, I have all of them here. But I want you to earn the next presenter. I want you to earn this next consultant because she's just too much. I cannot just give you like that because I'm the host, I can do that, okay? So from Dr. Omotosho's presentation, where do you have ADHD? Where is it commoner, in boys or in girls? Who can answer that question? If you were listening, these people listen though. Nobody even typed something else. Wow. You got so somebody even wrote 3 times more. Wow, you guys are awesome. Honestly, this is brilliant. So you're listening. Okay, that's good. I'm very, very impressed because whatever we are sharing with you now, I'm so excited for you because now you can empower yourself and empower someone else. I hope you've registered on our platform, www.checkadhd.org. It is very important so that all this information, you can get them afterwards. I see a lot of you asking about the slides. So people want to know how to connect with our specialists. Please make sure you are in there. If you are when you register, the advantage is that you get in a WhatsApp group and we can stay connected, to you. So it's very important that you serve as, advocates for this message that ADHD, it can be helped. Don't judge, seek help. Okay, don't judge, seek help. Okay, so you missed the first section. Goodness is just coming in. Don't worry. There's another consultant coming in now, and she's going to absolutely blow your mind. So the next speaker, moving on swiftly, is going to be talking to us about coping mechanisms and strategies for parents. We'll be talking a lot about that. Would also be touching on, a lot of people keep asking childhood energy and ADHD. What's the relationship with that? So she will be talking to us about that. So sit down very well, because we are taking it to another level. All right. So our next presenter, earned her basic medical training qualification from the College of Medicine, University of Lagos, and later received her master's in public health from the same university. She went on to specialize in psychiatry and is a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Psychiatry. She further obtained a subspecialty fellowship in child and adolescent psychiatry from the College of Medicine of South Africa. You can see that we gathered the people for you, okay? So she's also a senior lecturer in the Department of Psychiatry of Lagos University Teaching Hospital and College of Medicine, University of Lagos, Nigeria, respectively. She's the current deputy chairman, Medical Advisory Committee, DCMAC, at the Lagos University Teaching Hospital. Her clinical work entails providing specialist medical health care, and her specific area of interest is research, including public health, maternal and infant mental health, neurodevelopmental disorder, mental health stigma, school mental health, adolescent trauma, and adolescent substance abuse. So I really have to take my time to read all this, because it's important you know this. She plays an active role in mental health advocacy and skill development. With over 10 years ago, she pioneered a non-governmental organization known as Mind Trust in Lagos, Lagos, Nigeria. Mind Trust, you can also find them, mindtrust.ng on Instagram. They are doing lots of work through this avenue. You continue to develop mental health awareness programs, and they target youth mental health and family well-being. Till date, please, everyone, just scatter the chat room with emojis for this personality. We have consultant psychiatrist, Dr. none other than Dr. Yewande Oshodi. Yes, I have poured all the dry gin on the floor for you.
Thank you, Dr. Jules. The dry gin is appreciated.
And cola nuts.
And cola nuts. That was very kind of you. Thank you so much for that warm introduction, and lengthy one at that. And thank you for all you have done, over the last 2 days for this program. Good evening, everyone. As I've been introduced, my name is Yewande Oshodi, and I'm really excited to be here. You're all celebrated because of your commitment to supporting children with attention deficit hyperactivity disorder. So I would like to share my screen now, if I may. Yes. Can you see my screen? Let me copy Dr. Jules and say, type a Y if you can see my screen in the chat box. Okay. Okay, I can see the Ys. Thank you very much. Thank you very much. So we're good to go. So this evening, we're going to be just talking on a few practical things that we may experience as parents or caregivers of children with attention deficit hyperactivity disorder. We've learned over the last 2 days what it looks like. We've learned a bit about the features, the diagnosis, the symptoms that we're looking out for, us as clinicians, what we use in making diagnoses, and you as parents or teachers, what you can also be on the lookout for. And I think it's important we keep this in mind. Inattention is an important piece. A child just drifts away, zones out, not paying attention. These particular group of children, like Dr. Omotosho said earlier on, are very likely often missed because they don't disturb the class. They're just gentle there, but they're not making their notes. They don't complete their notes. They don't complete their work. They zone out. They don't listen to instructions, not because they're hyper or anything. That may be a group. You have the other group with the hyperactivity, and then you have the third group that has both hyperactivity and inattention. So I'd like us to remember that. So, lessons like this or sessions like this presents us with a bit of a dilemma about ADHD, which, as we all have come to understand, means attention deficit hyperactivity disorder. We all have an idea of the background, okay, of what causes it based on these lectures you've listened to. And with all of this, there continues to be an increasing awareness about the disorder. However, this presents a risk of wrong labeling. So I suspect some of you in the chat room are already going home and saying, hey, you, this child, is ADHD that is doing you. I have learned something today. Please, 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 you're not doctors, but we just want you to understand that some children may be struggling and just have a higher index of suspicion that could this child actually be needing help, and not that this child is just being a busy child. So there's that high risk of wrong labeling. And oftentimes because of this or ignorance, it can be diagnosed late. From what we have told you since yesterday to today, there's no test there's no blood draw that is going to happen to help in making a diagnosis. Literally, it's going to be based on a compilation of certain symptoms that occur over a certain duration of time. And our speakers have said that earlier on. We put these together based on certain standardized global criteria, and then a diagnosis is made. So there are clear criteria. So that brings us to the issue of energy. Is this ADHD or just a lot of energy? First of all, ADHD children, are they always energetic? No. ADHD is not always synonymous with being hyperactive. Can you hear that? It doesn't mean that every time you see hyperactivity, it's ADHD, and it doesn't mean that every time you do not see hyperactivity, that a child may not have ADHD. I don't know if that makes sense. So just think about that. So ADHD could be inattention plus hyperactivity or impulsivity, or you have the two together. So you can have inattention, inattentive type, the hyperactive or impulsive type, or you can have the mixed type. And you'll agree with me that that clearly tells us that the one that is inattentive will not be energetic. And it doesn't mean that every energetic child has ADHD. So what does this mean? It may be characterized at times with low energy and inattentiveness and no hyperactivity whatsoever. So that child that you say, go and get me something in the room and bring something else, not energetic, but is always easily distracted, is in a world of their own, is daydreaming most of the time, comes and says, Mom, I'm bored, I'm bored, I'm bored. You need to just double check and have that looked at, particularly when it begins to affect performance. I must reassure you that most children with ADHD, can do well academically, but they're not performing to their par, okay? So just taking care of it or reorganizing how we handle it can go a long way to help that child cope better. So it's possible to get diagnosed with ADHD without energetic behaviors. That's what I've said. So assessments will need to be made. And we all can remember what the core symptoms of ADHD looks like. So a critical distinction will be that ADHD symptoms occur and consistently and significantly disrupt the daily life and relationships. So you could get reports that the child, doesn't seem to have friends. The child, the friends seem to leave them out. Is it something that, they are doing, or how they are conducting themselves, or how they are being maybe a bit impulsive, not hyper, But impulsivity is that they don't think before acting. They're not processing things. At times they blurt out things. They're not jumping up and down. Remember, we're just trying to distinguish the hyperactivity versus normal hyperactivity versus ADHD. The other thing about ADHD is that whatever symptoms they're having, they don't have it only in one environment. They need to have it in at least 2 environments. So if a child has problems at school, but is fine at home, we may be thinking something else may be going on other than ADHD, okay? So a key difference between ADHD and high energy can be linked to attentiveness and impulse control. You know, high energy would make them, they'll be able to still pay attention, they may be able to control their impulse, but the ADHD will struggle with that. An energetic child otherwise will focus when prompted, so they're able to attend, and they oftentimes can complete a task to finish, and then they go off and they express their energy. A child with ADHD, on the other hand, will find it close to impossible or difficult to focus, and may even get frustrated while trying to complete a task. So those are some distinctions to keep in mind. A few other things is that they may have, children with ADHD have difficulty processing information. Hyperactive children may have trouble slowing down enough to process information accurately, and as a result of that, you know, they will struggle with school. The ADHD child is also overwhelmed and frustrated easily, and they become disruptive because they're, you know, they have an assignment, they throw their book, oh, I'm tired, I want to go and play, or, you know, they react, and because of that, they may become disruptive in class, disruptive with peers, disruptive at home. So they have friends visiting, they throw tantrums, they say so-and-so didn't let me play with the toy, and they scatter the whole thing. And this will build consistent poor social relationships, which makes them feel, you know, end up being left out, being excluded, and their self-esteem can be challenged, you know, can be affected. These children, like you've heard, Dr. Motosho said it, and Dr. Bello Mojid also referenced this yesterday, that they may struggle with executive functions. Executive functions is located in our frontal lobe area. And many times children with ADHD have delay in maturation of that part of their brain. And so because of that, that is the portion of brain that helps us as adults to be able to plan, to organize ourselves, to pay attention, to prioritize. But that portion is a bit slower in developing in the child with ADHD. And so they struggle with things like organizing, planning, prioritizing, and this may still, you know, further feed into the academic difficulty, which a child with just being energetic, you know, may not quite experience. You know, like I said, they seem to be less mature compared to their peers. And of course, that may also reflect in them making some poor judgments, okay, when they need to make smart choices. So they are a bit more at risk of poor judgment regarding friendships and risk taking. You know, they take risks, then later they think, if you understand that. They act, then later they think, oh, maybe I should have, but they've done it already. And as parents, we need to begin to learn how to support these children. So these are important distinctions. So as we are distinguishing ADHD from hyperactivity, it's important to also reiterate what ADHD is not. There are a few conditions that may look like ADHD, but it's not ADHD. For example, in the blue box, we have age-appropriate behavior. I've had people come to me in the clinic, they're bringing their 2-year-old, and they say he jumps and runs and does, maybe he has ADHD. I'm like, it's part of the job description of a 2-year-old to run and jump and climb. So it's fine. Let's be mindful of certain things that, but if you bring me a 6-year-old, a 5-year-old that's still, you know, a bit, you know, too much, a bit too busy, then we may need to take a closer look at it. So there's something called age-appropriate behavior. Other conditions like autism could have a blur at times with ADHD, while on the one hand, it could coexist with ADHD. On the other hand, at times it could be confusing because at times, because of the inattention, it seems that maybe they are not communicative, especially when they are younger, and people could wrongly label them as having ADHD. Intellectual disability is also one of the brothers of ADHD. They walk hand in hand many times, but at times also it's hard for people to separate that actually this may be just intellectual disability and there's no ADHD there because of the immature intellectual level Okay, seizure problems could also resemble ADHD, particularly when you have conditions like a seizure disorder that is known as absence seizure, which is almost like an absence seizure, where the person is there, but the person is absent. They're staring into blank space, and whereas they're actually having a seizure episode. So when a doctor reviews these cases, these would be things that we want to be sure that it's not this, but it's actually ADHD. Trauma. Children that have been faced with trauma and are experiencing PTSDs that are peculiar to children, their symptomatology are slightly different from what you find in adults, may also behave in ways that look a little bit like, could they have ADHD? Thyroid disorders, where we have thyroid levels being very high, the child could be very busy, hyperactive, and it could be mistaken as ADHD. Psychosis is also one. So it's just to highlight for us that there are other things that could be going on that could be mistaken. And this underscores the need for an assessment. Coexisting conditions, I won't bother going through that. Dr. Motosha has mentioned the brothers and sisters of ADHD that tend to sort of like walk together. I will still highlight some of them in my next slide. Okay, so these are some of the things that could, either relate with ADHD, be mistaken for ADHD, or coexist with ADHD, and quite a long list of them. Oppositional defiant disorder, learning disabilities, autism spectrum disorder, anxiety disorder. And the job of your clinician will be, with experience, be able to tease these things out and decide whether it's just ADHD in itself or there's something else going on. So when in doubt, you must always seek for a clinical assessment. And it's usually better to just say, just help me take a look, and we're reassured that, we're good, and you can get a few tips on what to do if it's not ADHD. And who do you ask for that clinical assessment? Because at times I find people go into the wrong places and getting not accurate, let me put it like that, feedback. A developmental pediatrician, okay, would be a helpful resource. A child and adolescent psychiatrist, a child psychologist, child mental health experts, that are used to working with these conditions could assist in clarifying, uncertainties where they exist. And we must always rule out these other conditions that coexist with ADHD. So this is just a general overview about high energy versus ADHD. And I'm going to just round up by saying that, remember, not all energetic children have ADHD. And also the converse is the case, that not all ADHDs will have hyper energy. Remember that. And we must look out for other features if we are suspecting ADHD. We've heard of them severally over the last 2 days. And when in doubt, please always get the child evaluated. So I'm going to jump right into the next lecture. Can I do that, Dr. Jules? Can I just go right into the second one? Or do you want us to pause?
Please go right ahead, ma'am.
Okay, so I'll just go very briefly and just slide into the second one, which is to focus on coping strategies for parents and children with ADHD. As we can all imagine, this condition can, it sounds like it can be overwhelming, not just for the child, even for the parent or caregiver. I keep using the phrase caregiver because you may not be, a child may not even be with a parent. It could be with an aunt, it could be with a grandparent, it could be, with, someone else who is parenting the child. And it can be quite a lot to handle. And it's nice to have a few strategies up your sleeve that you can use in coping with this. So parents experience quite a lot while, raising a child that has ADHD. It's very stressful. It can be demanding, the child is all around the place, drawing on you. You have to make sure you're supervising around the clock, and that can really get too much. There's frustration at times with the child. At times then we find ourselves complaining and criticizing and comparing. Can't you be like your brother? Can't you be like your sister? Can't you just relax, and listen? And we've been told that it's like telling someone who needs glasses that, can't you just see without your glasses? And you and I would never do that. So with a child with ADHD, once we understand, then our approach suddenly becomes better. And I like to tell people that almost 30 to 40% of the challenges with many children with child and adolescent mental health disorders is awareness. Once you understand what you're dealing with, then you can begin to approach it differently. You can begin to approach it the right way. You can begin to seek the right help. So knowledge and awareness is power any day. Okay, parents experience exhaustion. They also go through what is known as denial. It's a defense mechanism. And we all use it when we're not comfortable. Say, no, it's not me. No, it cannot be me. Oh, my child, no, how can my child have that? Denial of the problem. The downside, unfortunately, of that is that the child struggles needlessly for years. I've seen children who they're just getting their diagnosis in secondary school. And this child has struggled literally through primary school into secondary school. And the child starts getting treatment. The child says, it's almost like I can see clearly now. And I think Dr. Delomo did use exactly a similar phrase yesterday as she gave her own talk. There is a burden of care that could come with caring for a child with ADHD, emotional, economic. And I'd like you in the chat to just drop any other burdens, any other things you experience, while caring for a child that seems to have ADHD, so that we can feel your pulse. If you have any other words to describe that burden, please put it on the chat. Okay, they're also struggling with coping with the child's academic struggles, because a child not paying attention, not completing the assignments, getting into trouble, of course, it will affect the academic well-being of that child. And then you're then sitting with this guilt and self-doubt. Oh, I must be a horrible parent. Oh, I must have done something. Oh, where did I miss it? Oh, what did I do wrong? Oh, who is doing me? We're Nigerians. Who is doing us from the village? Those questions start coming up. And then there's the big one about confusion. I don't even know where to go. Who do I see? Where do I even start? And of course, that comes with the risk of maybe going to the wrong people. I'm just going to open the chat to see the suggestion that financial strain, sometimes I cry, burden of acceptance, you can see everything. These are real experiences, and I'm glad you're here. And I thank you for sharing, because it brings out the humanity of what you are going through. And as clinicians that see parents and see these children, we try to just understand, but it's just the tip of the iceberg, because we feel that pain and we empathize. But there is a lot you can begin to do. Okay? So first of all, I want you to realize that as negative as those traits may seem, they could also be framed differently in a positive way. They're hyperactive and restless. Wow, this child is energetic. Can you change that language and call it that? They're intrusive. Oh, this child is very eager. They can't stay on point, He sees connections that others don't, because they have this, they're really smart children, okay? If you just probe into their mind, oh, this child is so forgetful. Well, this child gets totally into what she or he is doing. Can you see that just reframing that for you as a parent, you begin to see that, yes, it's a challenge, but on the other hand, it can be a positive thing that you can tap into. Oh, this child is just disorganized. No, I know my child can be very spontaneous at times, This child is stubborn. Well, he's persistent and doesn't give up. He's inconsistent. He shows flashes of brilliance. This child is moody. I know he can be sensitive. He's very impulsive. This child is creative. So it starts with you. It starts with your perception. And indeed, in mental health, 5 of us could go through the same thing, and the way we experience that narrative, the way we interpret that experience can change the whole experience for us, okay? So there are several researches out there that have shown what parents go through. I have this particular article, Parenting Experiences of Living with a Child with ADHD, and they reviewed several papers, and over 21 papers were looked at. And the experience of these parents were synthesized into 6 findings. It's an emotional roller coaster between hope and hopelessness. Mothers, advocates in the battlefield within the system and the family. So you're having to advocate between the school and your family, having to speak up for your child in church, where the child is causing so much, activity, and your family. So you find yourself as a parent having to play that role, and it's okay. This tells you that other parents find themselves in that situation. Parents also experience a crossfire of blame, self-blame, and stigmatization. You know, in some homes, a dad can be, you're the cause, you're the one that spoils this child too much, you know, or someone else is blaming you, your mother-in-law, even your parent, you spoil these children too much, whereas they don't even know half of what you know. And that can be a challenge. And you experience stigma, people treat your child differently, and you feel bad because of it. You're shortly between being supportive and non-supportive services and professionals. People are helpful and some are just not helpful. And you're trying to filter through all of that, having to put routine structures and strategies. But you know what? Despite everything, some parents have said it's not all bad. So I want us today to just shift that dial of our narrative a bit, that it's not all that bad. Your child can get support, and there's so much that you as a parent, you can. I want to raise your hope and realize there's so much you can begin to do. Okay. There's this other article. Before I just go into the tips, I just wanted you to see that other people have stuff that they're saying. Okay, parents and their coping. This is another paper that how parents perceive and cope with the disorder, you know, amongst in their children that have ADHD. Okay, so we have parents who have, 5 themes were found in this particular paper. They say that, you know, children are saying, is there something wrong with me? Or, you know, is it me? Is it part of who I am? They have these questions. And at times they're wondering about the implications on their life. How long am I going to, you know, continue to be like this? And you as a parent, the way you help them understand and also endorse them positively that, you know what, you just have an occasional challenge in one area, but you're super smart. I know you can do this. I trust you. I know you do struggle at times. And once you understand where you struggle, you know, you can cope better. You would be amazed at how that can make the child a little bit more optimistic, and they own the process. And don't forget, these children, they're not going to be children forever. Some children actually go into adolescence with ADHD, and some go into adulthood with ADHD. So you understand why it's important to help them own the process, okay? And help them know that they can begin to learn to control certain things about how they behave. When you teach them, you know, we can make changes in the environment, slight changes that will support them. And also, you know, the symptoms and satisfying immediate needs, you know, how to manage that rather than be impulsive, how to manage those feelings when they come on, okay? I'm going to try and move very quickly. So important first steps to coping. Okay, let me look at the chat again. I see a few people have dropped a few other things. So I can, oh, sorry. I'm not responding to questions, but I'm just talking to comments that may have responded to the question I had earlier on. Okay, I think I can't see anything fresh. All right, so we're going to move on to immediate first steps, important first steps, let me call it that. Okay, so you're this parent on this couch, you're exhausted. Oh my God, how am I going to handle these children? Don't blame yourself. The children or the child, you know, is that individual, is an individual on their own, you know, and at times individuals are born with their own unique personalities, unique vulnerabilities, unique challenges, okay? And so it cannot be about self-blame. Yes, there may be things you need to learn as a parent to do differently. It's part of the journey, okay? So it's not about whipping yourself over the head, blaming yourself. I want you to know that you need to just understand more and learn more and then begin to adapt. Learn all you can about the disorder, get assessments done where possible, evaluations, have the child taken a look at, and be your child's advocate, you know, by speaking up for them in school, speaking up for them in other settings, and also equipping that child, you know. The other next thing that we need to bear in mind is learning continues to go on, like I said earlier on. Support groups could be useful allies where you can, you know, learn a thing or two from other moms. And I'm really happy that the organizers of this series are going to arrange how, you know, people can begin to support one another, get professional help, and use resources. So the strategies I'm going to discuss next, I'm going to put them as behavioral, learning or educational, you know, parent training, and the child focus, okay, and well-being as strategies you can begin to use right away, you know, as a parent, okay? So some practical strategies, okay? You need to begin to put organization and structure into place. Teachers that came yesterday were told about this, but it's not enough that it's done in the classroom. It's important that it's done also at home. Create a structure. You go to bed at this time. You need to do this at this time. You need to watch the clock. You need to keep, what do you call this? A journal or a diary that can help you remember. As the child grows older, that you can help them have lists that help them to be organized. Make a routine for your child and try and encourage them to stick with it every day, and simplify and organize your child's life when you begin to do this. Give structure. You cannot be chaotic while your child is being chaotic. You need to be more organized, and help that child by extension become more organized and grow into that organized. Then they'll begin to like, oh, at 2 o'clock I do this, and once it's 2, then they get up and they do what they need to do. But that will only happen if you are consistent about it, okay? If you're haphazard about it, there will be no learning. Be clear and consistent. You give instructions, be clear. I need you to bring the red bag on the chair. Don't say, bring the red bag somewhere, just check out there for the red bag. That's not clear, so that the child can follow the instructions. At times you may have to ask the child, repeat what I said, so that you're sure that the child hears it, and you're also consistent with rules that you set. Rules help to protect and help to provide what I'll call a scaffold. Some of you that have observed houses when they're being built, you have these iron things that are, can any of you all know what scaffolds are around that they used to paint? Painters climb on it. If you do, put a Y in the chat. I get what scaffold is, so scaffolds are things that are put around buildings, okay? And people that are building or working on the building can climb on the scaffold around. You need to erect scaffolds around your child, because on their own, they don't have the competence to do that. Things that other children, some children are literally born with scaffolds. They're so organized. But children with ADHD may struggle with that. And if you don't put that in place, then the things will just begin to crumble and fall into pieces, so that they know what is expected of them. Make rules simple, okay? When you finish you must eat your food first before you do this. When you finish your food, then you do this. Do you understand? And very simple. It's not that finish your food, put this upstairs. Too many instructions, they would get confused. Make the rules simple and follow through with them. That includes consequences for misdemeanors. I did not say punishment, consequences. If you don't do your homework, you don't get to watch TV. That is a consequence. It's not a punishment. It's not to make the child miserable. It's to help the child to learn. If you don't finish your homework, you must make sure that child does not watch TV. That is being consistent. But if you say, okay, don't do it again or tomorrow, then you're not being consistent. Then the child will not learn that because I want to watch TV so much, I need to finish my homework. Okay, so we must be consistent as parents. Set boundaries and use consequences. I've said that earlier on. They need consistent rules that they can understand and follow, and make it simple and clear. And they would many times learn to adhere with it. And not too many, not ridiculous, but things that can be consistent. And they usually would try. And at times they would fail. It's fine. Then let the consequences play out. And don't let the consequences be damaging consequences, that if you do this, I will never pay your school fees again. Haba, what did we do now? It's not that hard. It's not that serious. You have to be practical. Little things, you just withdraw little privileges, or you give little privileges when they fall short. Am I communicating? Please put in the chat if I'm communicating, okay? I need feedback. You can't talk to me, but I need your, okay, why? I can see that, okay? All right. All right, so we're good. So let's continue. Okay, so boundaries and consequences, we're pretty clear on that. The next thing is activity and sleep. These children, oftentimes, particularly those that have hyperactivity or impulsivity, they have a lot of energy to burn, so you have to intentionally encourage exercise. Allow them, go and play ball, let them get dirty, let them, jump on the swing, give them time to go and burn out and come back fully exhausted, and they sleep. But put it into a structure. Okay, there's certain exercises that can really be helpful for them. If they have it in school, let them participate. For all like Dr. Motosho reminded us, we may have the next Amusho in the making, literally, so Don't cage them. Don't say, you play too much. You need to read your book. Yes, they may not be getting all the grades you want. That's because they're not paying attention in class, but let them burn and they may begin to excel in this also, okay? And then regulate their sleep patterns. Don't let them stay up late because they need their regular sleep hours to be able to function optimally. Remember, I've explained to you that biologically, many of these children are struggling with even maturity of their brain cortex, and they will achieve maturity. It may just take a little while. It may just be running a bit behind their peers, but they will get there. Okay, so let them get enough sleep. When they sleep, the brain is refreshed, it's rejuvenated, and it can go on and learning can continue. Dietary choices. What are the dietary choices we're making? You know, the research has shown that restricting certain foods in itself is not treatment per se, but it is helpful in containing some of the symptoms, okay, of ADHD. So I want you to understand that, because some people say, and once you do this, you do that, you've treated the child. It's not treatment, but it helps in containing some of the symptoms. And things like fizzy drinks, junk food, sweeteners, additives, colorants have been found to increase some of the symptoms, particularly the hyperactivity and impulsivity, and possibly to some smaller degree, the inattention. And research has also shown that fish oil supplements have quite good evidence for helping build attention. And fish oils, you can buy it across the counter, you know, cod liver oil, fish oil supplements. They can take it along with their vitamins every day. You don't lose anything. And cheaper options, you can buy them, what's this fish? Titus. It's rich. It smells horribly. I know. You may not like the smell, but Titus is very rich in fish oils. You know, so you can have them have that with their meals regularly. And that way you're also giving the brain something that is useful. So these are the things that there is some research evidence for concerning diet. Please don't starve your child in the name of diet. I heard that they said, or I heard they're selling something here, that they'll just collect your money. I'm telling you from quite a few years of experience. Social skills, we need to help teach them simple social skills, you know, courtesies, can I have something? Not that they grab it and they snatch it. That's what makes them get into trouble, because remember we said that they're impulsive. So they're not thinking you want something, just snatch it out of the person's hand. You may need to teach them, you need to ask, you need to say thank you, you need to offer, you need to ask before you carry out certain things. And that way will help modify things that ordinarily they're not thinking about. And when you're consistently, you know, pointing it out, the child will learn, okay? Because what makes it harder, it's almost like a double whammy. It's enough that you have an ADHD and you're struggling with that, then you now don't have friends. How bad can that be? And children want friends, most children. They don't want to be left out. But when people, and children can also be really mean. I don't know if you've seen children deal with other children in schools. So you don't want your child to be that child that gets picked on because they're socially impulsive or socially get into trouble. I remember there was one child that was brought to me a few years ago. He would put a string along the way and trip his classmates and would laugh. And they'll be so angry with him. And he found it so much fun. And, you know, he'll be talking in class, making jokes, getting into trouble, always in detention, you know. And of course, what do you think? He was getting the label. He's so stubborn and disobedient, whereas it's ADHD. So there's some behavioral techniques. We don't have time for me to fully unpack, but I just thought I'll just reiterate it. I think it was Dr. Bello Mojido or Atilola spoke on a few of them yesterday. Positive reinforcement. You want to encourage what you want to see more of, okay? At times what we focus on is what we don't want to. Stop doing this, stop doing this. No, you need to find a way to encourage. You know what, whenever you finish your homework, I'm going to ensure I give you a treat. That way you're encouraging that behavior you want to see more of. Parents, please try and reduce the complaining at your child, okay? Because you further erode their self-esteem when you do so. And I know it's your own frustrations that's coming through at times, but compliment. Consciously look for opportunity to praise them, okay? Provide rewards or privileges when you see the desired behavior. Give them timeouts. Yes, if they are, you know, doing unwanted behavior, you may need to take, you know, that activity away from them for a period of time, for a season, and then give it back hoping that they've learned, and explain to them. Don't just take it and say, you're never going to have this again. It could be that I'm taking it away. You're not having it till tomorrow. I need you to promise me you're going to work on it before I give it back to you. And, they'll go, Mommy, I'm sorry. Yes, it's fine. And then give them a go again. And they may still break the rules. Yeah. Don't get tired. You have to just be consistent, and learning will go on. There's a cost, okay, for behavior, okay? So you may need to withdraw rewards or privileges when you do see unwanted behavior. But like I said, we'd rather you use positive reinforcement more, but at times you may need to use response costs. And token economy, where you combine rewards and consequences together, where a child earns rewards and privileges when they perform desired behaviors, or they lose it when they do not have, as a result of unwanted behavior. I think that's pretty clear, right? So learning, this has to do with school and education, because yes, we've spoken to the teachers, but as parents, they're doing homework at home. They have lessons. You need to prepare them for school. So ADHD in itself can affect learning, okay? You may need to motivate for your child to get an individual education program, an IEP. Those outside the country really understand this, because abroad there are services that are well wrapped around and they're organized. Once your child gets into school, everything comes in. Unfortunately, those of us based in Nigeria, we don't have that robust one-stop shop. So as parents, you have to be the advocate. Yes, it's a function of, let me just say, the Nigerian challenge, and I don't want to even go there, but the most important thing is that you want your child to thrive in spite of, this environment, in spite of these challenges. So you may need to interface regularly with the teachers and find out what's going on, how are they achieving compliance, and how much progress are they making. And you may even be the ones to provide some hints to the teacher, of course, in a way that is not, you understand now, not a way that is going to be critical and like you're trying to teach them their job, but you are collaborating with the teacher. Help the child understand, I've said that before, that ADHD is not their fault, okay? But also understand the symptoms and understand that they need to become more self-aware and begin to work on some of these things, improving on them based on these little hints we're giving here, and their scheduling, having a calendar, trying to work with their calendar, trying to work with their journal and stuff like that. Limit distractions around learning. So they're supposed to be learning and music is playing. I've seen a child before say that I need music when I'm, music has to be playing when I'm learning. But the music is not just calm, instrumental, it's loud. You're not going to learn that way. So you may need to negotiate that. I know that some children with ADHD, they need some distractions to be able to achieve some content. So it's a delicate balance, that you want to achieve with them. Allow short breaks. Don't say you must study for 2 hours and sit down. Sit down there, you have not done your homework. Say, finish this assignment. I'll give you a break when you do 30 minutes and you finish this portion. Okay, get a 10-minute break, and you must make sure they come back. I know it's hard, but once you know ahead, then you can also organize your own self, okay? Short breaks will help them handle boredom and will also help them with focus, okay? Encourage out loud thinking. At times, it helps them from being derailed by internal thoughts, For example, even when they're reading, they can read out aloud. It helps them refocus to what they're reading rather than their mind wandering off, So you can encourage that, It may not be easy to do all the time, particularly in school. Another tip, which I forgot to put here, is that they can also they can begin to read with their fingers, following the lines, Children with ADHD, little hints like this could come in very handy with them when they're reading, or else their mind just wanders off. Empower them, help them to learn ways to improve the problems that it may cause. Like I've spoken about the coping skills earlier on, okay? Make time to talk with your child and relax and enjoy and have fun activities so it's not just scolding and chiding and chastising them, but you're also, giving them opportunity to learn a thing or two. Okay, so Dr. Jules, I'll need a prompt. You can please unmute and just let me know how much time when I have.
Yes, I actually sent you a direct message.
Okay, I'm not reading my messages now. How much more time do I have?
Well,
I'm rounding up, but
yes, let's just give you like five.
Okay,
So
I'm going to try. Okay, so some of them are not motivated. Thank you, Dr. Jules. They're not motivated. So some tips you can give them for not being motivated, breaking their project into manageable pieces, do this bit first and show me, then you tell them to do the next. But don't say, go and do this one massive. They're not going to. They'll just, either they'll rush it, or they'll do rubbish, or they won't even do it, okay? Give them enough exercise, like I said earlier on. They should work on frustrating tasks for shorter periods of time to beat being overwhelmed, small realistic goals, and they should reward themselves, and reward them for accomplishments. So these are a few things, that they can use. You can give them at home, and some of them can be used in school timers. If they're going to get break, okay, work for 15, when the timer goes off, you can get a break and come back, create charts. You can have a small board. This is what you do on Monday, Tuesday, Wednesday. Daily things to do, check boxes, they should tick it, particularly, I know moms, you're working moms, you're busy, if you have this structure and you have them sign up to it, they can use these things, set alarms, bedtime, routines, and use of planners, okay? So I'm going to move very quickly now. So some child-specific things you can do, find that time for special time for you and your child, okay? If you are constantly just being negative, doesn't help. I've said that, I cannot say it enough, okay? Notice when they succeed, no matter how small, and celebrate it, be dramatic about it. They're drama people, they like it. They feel happy, they feel inspired, they feel energized, and they'll go on. Tell them and reassure them you love them and you support them unconditionally in spite of their behavior, because it's not their fault. Assist them with social skills, like I've said. Identify their strengths. They do have strengths. It may be athletics, computers, mechanical building. Identify it and give them time to do those things. While, the boring things also, you say they still have to do it, but they have time to do fun things, okay? Equip them with social skills, okay? So I think most of these things, I've said them already. Praise that child, okay? Like I said earlier on, the way we frame the features matters a lot. My child is energetic. Oh, he's very verbal. He's creative, he's exciting, he's really fun and warm-hearted. These are positive ways of reframing, some of the difficult behavior you may face from time to time, and see it from that angle, that they could actually be positive, that you can help them cultivate and learn. So your own self-care is important. Learn about ADHD. Get parenting sessions or parental training sessions. You can speak to experts. We can have these kinds of one-on-ones, when you come to clinics, or, even online, there are lots of things, resources, international. I know that the organizers are putting stuff together. Coping skills training for yourself this time, not for the child, okay? Take time off. Indulge yourself, self-care. Get your own mental health support if needed. If you are struggling, there are support groups. Ask and get support from family members. You can take a day off, just go and indulge, have a weekend away, have someone else look after them for a bit, okay? Please take care of yourself. I cannot finish this talk without talking on this slide regarding medication. I know it's not the thrust, but parts of the strategies is that some children will need medication, okay, along with the behavioral strategies. And research shows that good outcomes can be facilitated by behavioral strategies and medication for some children, not all. And your own apprehension and concerns, we understand. Oh, I don't want my child to be on meds. Is it going to be addicted? What's going to happen? We understand it, but why deprive your child of something that may help them? Think about it that way. So there's that group. And I know many of us are Christians, we reject it, we pray, we kabash, we speak, we do all of that. Please remember that your faith and medication are not fighting one another. Indeed, if we find meds that work, it may well be answers to your prayer, because I see this all the time in clinics at times where, no, we'll go the spiritual way. And you're depriving this child of the answers that God himself has provided. I just had to just touch this for us all. So we remember that assessment and evaluation. So in conclusion, there are things you can do as a parent. You're not helpless, you're not hopeless, you're not alone. Things can be done to help your child. Be involved and learn more. Your self-care is important, okay? Yes, you take care of everyone else. You must make sure you take care of you, all right? And assessment, evaluation is key to proceeding and providing ADHD care and support strategies. On that note, I want to thank you for your attention. Thank you very much.
Wow. Are you people still quiet? I don't understand.
Thank you.
Like, is this room quiet right now? Please let's appreciate Dr. Yewande Oshodi for that powerful. I mean, I feel like if I see somebody tomorrow, they've hired canopies and they are wearing graduation gown because of these lectures we've had in the past, I will attend that party, because this is a lot. This is loaded. Oh my goodness. We can see everyone appreciating, this class. This is just absolutely awesome. Thank you so much, Dr. Oshodi, for that powerful presentation. I want to call up all our speakers now. I see all your hands raised. Thank you so much, everyone, for your appreciation. Don't go far. We're going to move into the next segment swiftly. I know you've been asking questions, and thank you so much. Dr. Omotosho has been answering as many as he could in the background. Thank you so much, sir. We appreciate your efforts to help us with their questions. So we're going to move on to the questions now, and this is how we'll do it. We'll take a couple of questions from the live chats first, and then we'll take questions from our website, because we saw all the questions that you sent in. So we'll do that. Then for those of you that might not be able to operate the chat button here, you can go to your WhatsApp, the WhatsApp group. We have 2 groups because we had so many people sign up. You can go in there and type in your questions. And when I get to the WhatsApp segment, we will take your questions, okay? Thank you so much, Dr. Oshodi. That was beautiful. So we want to take the questions now. No need to raise your hands, okay? We'll be taking the questions from the chat, so you can drop them there. All right. I see a lot of people here that were here from the last class, and that is very, very nice. A lot of people are asking questions about supplements and stuff like that, flaxseed, black oil. I don't know if Dr. Omotosho answered them. Dr. Omotosho, are you there? Asking questions about the vitamins and if they play some form.
Yes, I'm right here. I'm right here. Awesome. I hadn't answered the one about the vitamins and cod liver oil. I was taking some of the other questions, and then I see that some questions are similar, and
exactly.
A few of them are for Dr. Oshodi, like questions about Lagos. How can I be assessed in Lagos? We've gone to Lassuth. We've not been able to get a diagnosis.
Your video, sir. Can you put on your video?
Yes, I can. Using multiple devices. So I hope you can see me now.
I can see you. Yes, but
I hope I'm not upside down.
You are not.
Okay, yes.
Go ahead,
okay,
sir.
I think this works.
Yes, because
all right, yeah. So I was saying that a few of the questions were.
Sorry to cut you. The response you were giving were quite informative, just in case somebody must have missed it. If you can just summarize what you've answered in the chat so that we can carry everybody else along. That will also help minimize the ones that I would bring up. Thank you, sir.
All right, beautiful. If you give me a minute, I'll be able to summarize so that it would actually be quite short. Yes. I'll just look through, because I'd answered quite a number.
Dr. Jules, the questions are really many in the chat, and there's so many things in between. So if someone could help us extract them, and you could assign the questions, it will help. Because I can't even scroll through. There's
exactly. So, Dr. Oshodi, if I may.
I had outlined while you were presenting, sorry to cut you off, Dr. Omotosho. While you were doing the presentation, Dr. Oshodi, I was like trying to bring out some of the questions, but I noticed that Dr. Omotosho had answered them. So he can just like give like a summary of all the things.
I guess there are a few other ones coming in now. Maybe you want to scroll up from the bottom so you can capture those while he's doing that. Okay.
I'm doing that now. Go ahead, Dr. Omotosho. Thank you.
All right, thank you very much. And thank you everyone for your questions. Those questions actually showed that people were listening in the Zoom room, and it was an engaging time for all of us. Someone wanted to know about children who are active in the womb. That what would we say to that? That some parents complain that the children are quite active in the womb. And since we're talking about something related to hyperactivity, what would be our comments on that? So my response to that was very brief, that it was an interesting question. However, the fact that a child is quite active in the womb does not mean that that child has ADHD. And ADHD is not even diagnosed in utero, which means in the mother's womb. And the child has to have advanced in childhood for us to make that kind of diagnosis. And children can be active in the womb for various reasons. Some of them, when there's a stimulus like music or even the voice of the parents, they may become active. Sometimes when the mother eats, some children become more active and all of that. So that was my quick response to that. Some other people wanted to know about dual diagnosis. Someone said that her child that had autism recently had a diagnosis of ADHD. So mainly my response was empathic, because that person is already receiving therapy. And we had already mentioned in both presentations about comorbidities and the fact that when somebody, comorbidities just means if somebody has ADHD, all of those other cousins that we mentioned, and like Dr. Oshodi put them, brothers and sisters of ADHD may also accompany the diagnosis. There's a question or two that I think they were specifically for Dr. Oshodi. Someone was asking about Lagos, that how can I get help in Lagos? Somebody else mentioned that I've been going to LASUTH repeatedly, but we're yet to get a diagnosis. So that was for Dr. Oshodi. And then the second one for her was about nutrition, because she was talking about Titus and talking about things that don't have to be expensive. So people were asking questions related to what about cod liver oil, what supplements can I use? And I see that even right now,
let me quickly jump into that. Should I quickly do that?
Yes, please. Yes, please.
So first of all, to get diagnosis in Lagos, there are experts in Lagos, okay? So we have developmental pediatricians, okay, in some hospitals. The teaching hospital, Lagos University Teaching Hospital, we have a child and adolescent psychiatry unit where I work. We also have a department of pediatrics where we have pediatric neurologists who help in diagnosing ADHD also. I know many parents would rather go and see a pediatrician. It's fine. Just make sure an expert is seeing your child. Some of you will run away from seeing a psychiatrist, it's fine. But as you can see, Dr. Motosha and we're regular people and we see these children. Lagos State University Teaching Hospital, that's LASUTH in Ikeja. Many times they mix it up. LUTH is in Idiaraba. That's Lagos University Teaching Hospital. LASUTH is in Ikeja. LASUTH also has a child and adolescent psychiatry team. And Dr. Atilala from yesterday works in LASUTH, and you can also get assessments done with him. Now, even in the Federal Neuropsychiatric Hospital, Yaba, that's the place a lot of people wrongly label Yaba left, but not in Yaba, in Oshodi. They have a branch in Oshodi. They have a massive, center for child and adolescent mental health, and they make diagnoses there once your children show up. And most of these centers were so open that we won't even drive you if you don't come with a referral letter. Just come, first of all. We are willing to try and see what to do to help. Okay, so these are the government facilities. Of course, there are private settings. There are centers where you have psychiatrists or psychiatrists that deal with children that could also assist with these assessments. So please, in Lagos, there are options, okay? And we want you to, and I'm sure that the organizers will probably provide some kind of arrangement where you can have contacts, places you can go to, resources that you can utilize. I also saw in the chat, someone said about Abuja. I know people also in Abuja. We have child psychiatrists in Abuja that can, assist. And we have the Association of Child and Adolescent Psychiatry and Allied Professions, that's ACAPAN, that Dr. Motoshaw is the secretary, current secretary. I was the past president. This association, we have psychiatrists that deal with children all around Nigeria, made up in that association. And if you send in a request, you can always, if you're in Borno or Benue and you need a psych, you can find the nearest child mental health expert to you that can assist in providing assessment. Cod liver oil is good. It's fish oil. It's nicely packaged, it's in bottle. There are fish oil tablets that come in capsules. They're also good. These are, I'll say, supplements that are okay. There are other things that you find across the shelf. They'll say this is brain medicine for ADHD. I don't know about that one. The one I told you are the ones that there is evidence, research evidence for its efficacy. Fish oils. And if you cannot buy the supplements, you can give natural fish. And I gave the example of Titus. I don't know, is Titus the same as mackerel or they're different? I think also mackerel is said to be also very rich. I think that's a cote. Mackerel will be cote fish. Okay, so just parboil it. And, you know, they smell awful, but if you do it nicely, you know, it can actually be a nice supplement. You take out the bones and constantly add to their food. It can be helpful supplements, okay? Yeah, that's all I'll say for now, except there are other questions around that.
All right, thank you so much, Dr.
Ginkgo biloba, no. Someone put Ginkgo biloba. Someone put Ginkgo biloba there. Ginkgo biloba, no, please. Thank you.
Okay. All right, so we have Aishatu Adamson. She said, it's everything that you just mentioned that she's going through. I know that my son is in the ADHD and autism spectrum. Doctors have even said so, but we can't seem to get a diagnosis. I want to get a proper diagnosis. It's difficult at school. Some family members think he's just spoiled, and I've fought with, you know, many friends and clients because of how they see my son, you know. So she's looking for ways to, like, what can she do now? Because she's like, he's within that spectrum of ADHD and autism. They don't know what the diagnosis is. So Dr. Oshodi, can you
okay, so first of all, you know, at times, yeah, and I'm saying this, I'm trying to be very balanced about this. As a doctor, I know it's nice to get a diagnosis. And why is it nice? Then you can get the other things that you need. While you're waiting for a diagnosis, however, there's a lot you can do. Make sure you are the voice for your child. And you don't have to go and be fighting people. You need to just explain to them, okay? Otherwise, they'll say, I don't mind, it's just, you know, there's these parents, I don't like listening and all that. Let them know you identify the child is struggling. Let them advise, you know, just be a partner to the schools. Don't forget that they're also struggling. That child is stressing them out also. So be a partner. Be the voice. Say that, teacher, I thank you so much for what you're doing. I know it's hard. You know, let's see what we can do. Give me suggestions. I'm also doing, oh, I read this up. Can you take a look? Be that voice for that child. Now, as for getting assessment, and it's helpful because, like I said in my last slide, talking about medication, some children require meds. It's just what it is. The ADHD is so much. They cannot progress academically, or they'll keep getting into trouble, you know, or particularly the hyperactive ones, or even the inattentive ones. They're failing because they are not paying attention. Yes, I remember there was a question, they said, who experiences it more, the boy or the girl? The boy, yes. But unfortunately, the girl child may also be experienced, but may not be hyper, may be inattentive, may just be quiet there, daydreaming away, not completing their work, you know, being very busy, you know, with them drawing and scribbling and sketching on their books, drawing cartoons, you know, or, you know, comical features, you know. So please get an assessment while you're waiting to get the assessment, and particularly for you, mom, that you say that they've said ADHD and autism. Remember, we've said that at times these things go hand in hand, brother and sister, they hold their hands together in some children. You need to get an assessment. That may inform options of education. This child may actually need to be in a school that, and when I say school, please don't be scared. I know that there's some special schools that no, God forbid, you know, but there are some schools that they're a bit more intentional about the support they give. And it may not even be an overall special school, maybe a regular school, but they allow, you know, some kind of facilitation for the child as needed, particularly children that have autism and ADHD. They may need a lot more support than just ADHD alone. So please be encouraged, that mom, and try and continue doing what you know to do, and try and still get this assessment. I wanted to say one thing to our parents here, that I know you're all amazing parents, and it's an assumption because most people want to be good parents to their children. They're trying their best, okay? But there's always room to do something extra, to learn a better way, to begin to approach things differently. And the earlier, the better. Thank you very much.
Thank you so much, Dr. Oshodi. There's a question from Mary Oluwaseyi, and she says, My son is 11, doesn't complete his notes. He's always carried away in class and he's in the boarding house in the Catholic school. Should we withdraw him? My son has good in him. As in, this really touched me when she said that. The priest once asked us to come take him, that they should come take him. And I quote, she said, the priest said, once asked us to come and take him. Oh, you know, this broke my heart to pieces. Can children like my son fit into a boarding school? Dr. Motoshaw?
Okay, and I think this is a very brilliant question. Unfortunately, many people have had to go through challenges with labeling, stigma, and our heart really goes out to you and we empathize with your experience. Well, absolutely, a child with ADHD can actually go through boarding school. The thing though is that, remember that ADHD can come with attendance challenges. So if some of those exist, it may be good to either have some way in which you're having help for the child, or if the school is such that it has inclusive care, that may also be helpful. Or if there's a shadow that helps the child with certain tasks, that may be good. What we sometimes do is that we relate directly with the teachers or the carers in that school, because they stand as the caregivers, the local parents. So if we relate with them as well, sometimes we offer some suggestions about things that can be done, since that child is not a day student, is a boarding student. But yes, there are boarding students who live with ADHD and they do well.
Okay, awesome. Thank you so much, Dr. Motoshaw. Let me just take one more question from the live questions. We have a question from Aminat. She said, as a teacher who discovered this in a student, I noticed that the parents and notified the parents, but they seem to be living in denial and ignore all advice given. Yet this child keep progressing in this behavioral issue. What do you think, one can do in a situation like this? And I pull it up. This is a teacher, I'm assuming, but I pull this up because I think it will shed more light to acceptance. Dr. Oshodi.
Thank you very much for that question. And your experience is not, uniquely, it's not a unique one in the sense that many teachers do experience this, particularly when you've become aware of these kinds of situations. And unfortunately, parents that haven't had the privilege of having this kind of training could still be stuck in denial and be very difficult, okay? I would just encourage you to continue to empathize in your mind concerning this parent. It's not easy to come to terms, okay, this is what is going on, number one. It helps that you have pointed. I've seen patients that will come to me and they'll say, a teacher told them when this child was in primary school, but they didn't think about it. They didn't take it serious. Now this child is in secondary school or in uni, then they realize that, oh, that teacher was actually right. You may be that piece in the journey that will reinforce and reiterate the need for help. And by the time they're hearing it from one or two people, they may yield and get the help. So I think you can only do what you can do. You cannot force someone's child to go into treatment. If you have a school support system, like school counselor or school psychologist system that can escalate and encourage parents to get assessment, you can run it through that system. If you don't, there's not much you can do beyond what you have learned to do in the classroom to support the child. And also providing hints to the parents of what they can do at home based on some of the things we've taught here today, that your child, and as teachers, I've seen parents who say, teachers just complain about my child. They want to label my child. They want to say my child is so bad, okay? So as teachers, be very, I'm not saying you shouldn't say the truth, but be emotionally sensitive about how you approach the subject with the parents, okay? Oh, your child is fantastic. We know that he's brilliant, but we know he's not achieving as much as he can, his full potential. We're just thinking maybe we could do a thing or two, and we have a few suggestions for you. At times some children with this behavior may be suffering from so-and-so, and you may want to consider an assessment. You just say that by the way, but in the meantime, can we do this? You know, so you've said the same thing, but you're not pushing them, and you're still going to try and help the child one way or the other. So that's what I would suggest. Thank you.
All right, thank you so much. So there's also another question here. So I'm moving on to the website questions before I take the questions from WhatsApp. And Dr. Motosho, thank you so much for answering the questions. There are so many. We really appreciate your service.
The pleasure is all mine.
Yes, there's a lady, okay, on the website. Her name is Francesca Elueche, and she said, my son is hyperactive, but does lack focus in math. He's restless, and he is authoritative when he speaks. He has bad handwriting. He's easily distracted. And can all this be tagged to symptoms of ADHD? My sister-in-law feels it's ADHD, but I refuse to accept any name that God does not give us. What do you say to that, Dr. Omotosho?
Yeah, I think that this is an individual that is trying to come to terms with the fact that the symptoms already look like ADHD. In fact, given the way the person wrapped up the comments, it shows that the person pretty much knows that these symptoms look like ADHD. So the question this person appears to be asking on the subliminal level is really not, is this ADHD, but rather, can I persist in my belief that this is not ADHD and there'll be no consequences to that? It appears more in that direction. So what I would simply do is to encourage this parent to seek help. Truth of the matter is that there are actually consequences of untreated ADHD. In fact, as Dr. Oshodi was speaking, I almost pulled up a slide in that direction about consequences of untreated consequences of untreated ADHD, because it's important that if a child has that diagnosis, let the child get some help. That statement, for instance, about the names that God did not give us, I think if you want to have a religious explanation, you possibly should even look at it from the viewpoint that once something has a name, then it means that it's subject to God's name, and you can actually get solutions to whatever problems that you're dealing with. As Dr. Oshodi mentioned, your faith should not be in the way of taking medications or getting help. Let me put it this way. If a car broke down, would you see anything wrong with going to the auto mechanic to fix the car? You probably wouldn't see anything wrong with that. If you're running low on gas in the car, would you see anything wrong with going to the filling station to get some fuel into the car? Probably not. So why is it that when it comes to our physical bodies, which are definitely more important than all of those other things mentioned, we sometimes are hesitant in getting help? So I'll encourage this person to get help. This is about the third question I'll see in the chat room that has to do with denial or refusal to accept diagnosis. But my comments would be to encourage the person to get some much needed help.
All right, thank you so much, Dr. Motosho. So we have another question here before we move on to WhatsApp questions from Oggenerume, and he or she is asking, can one notice this ADHD in a child less than 1 year? And I'll make it compound because there's another question that refers to that. And can it be cured or reversed as soon as we begin to notice the symptoms? Dr. Oshodi, in a child less than 1 year, can you notice ADHD, and can it be cured and reversed as soon as it is noticed?
Okay, so first of all, ADHD is a diagnostic entity. We diagnose it, and that diagnosis cannot be made before a certain age, okay? What I'm trying to say is a child that's an infant, or you said less than 1 year, that's an infant, you know, so no one's going to diagnose ADHD in an infant, okay? And no doctor, I mean, last I checked, you know, with our trainings, you know, so that's a straightforward answer. The second part was, can it be reversed? So I'll take it now that, okay, let's say the child is an older child, say maybe the child is 4 or 5 or 6. Are there things you can do to reverse this and cancel the experience of ADHD in that child? Well, some of the things that we're saying, putting structure, supporting the child, helping the child have some social skills, I think can minimize and reduce the effect of it. And people can also grow to learn how to manage themselves. Remember, I said, help the child understand their own self. It's like telling, let a child know that, some of us wear glasses and we've been wearing it since God knows how long. Oh, you need to wear your glasses to see. Remember that if you don't see well, you won't be able to write well. Or you need to make sure you make reminders for yourself so you don't forget. You've seen that there's a pattern that you tend to forget things at times because you're really busy. I don't know what you're thinking, in a playful way, but you allow that child own that process. And you can see these reminders help you to not forget submitting your assignments, So those are things that I think I want to look at it as things that can help minimize the negative effect of the symptoms of the disorder. Of course, a lot of things I said earlier on in my talk, and yes, it will be things as a parent you can put in place that can minimize it. Thank you.
All right, thank you so much. So we have a question in WhatsApp. I'm in the first event room now. We have 2 events room. And the first question here is from Olufumi. So she's asking, my 10-year-old son has issues doing chores for as long as ever. I virtually have to, I guess she meant literally, have to remind him every day about them. Countless number of times I've had to sit him down to make him see the benefits of doing chores. He always appears sober and willing to turn a new leaf. It shocks me the morning after that I still have to remind him of the same chores. Other times I've been frustrated to the point of nagging and punishing even. I see this as laziness. Am I wrong, or is this just ADHD? Dr. Omotosho.
Okay. All right. So I hope you can hear me.
Yes, we can.
All right.
We can't see you.
Okay. All right. So this is a child, from what I've gotten, who is forgetful. You tell the child to do something and then the child forgets. You have to do daily reminders. Even the following morning, you still have to remind. It may be ADHD, but then we would need to ask about other things. Remember that we said that ADHD has 3 pillars and there are different types. There's inattention, impulsivity, hyperactivity. So we'll still have to ask questions around that. However, whether or not this child has ADHD, like Dr. Oshodi was trying to emphasize, let's not be so emphatic on the name of what's going on. Let's identify the problem for what it is and then proffer solutions. If there's a child that's forgetful and that has been significant enough to affect the child's functioning in different domains, then by all means, there are practical things that we can do to help that kind of child. So you can have, for instance, which is what we sometimes do with ADHD, a timetable that helps the child know that per time, this is what you're supposed to be doing. That can be pasted in the child's room. It can also be pasted on the refrigerator, say at the dining area, or in the kitchen, areas where the child goes to, so that there are prompters and reminders. Also, some people use apps. An app like Procrastinator is used by some on their mobile device to help a child who forgets or who procrastinates or who just seems to fall back on their tasks and things like that. So yes, by all means, beyond the diagnosis being ADHD or not, I would say that if a child has challenges with forgetfulness, some of these practical tips should be engaged.
It also will. Absolutely. Thank you so much, Dr. Mososho. We have a question from Rehoboth. I hope I pronounced that right. And it kind of represents a lot of questions coming in. He said, how do I handle a child who does well orally, but finds it difficult putting it down in writing? Knows the definition of terms, but puts it down halfway. Also very playful and mischievous. Forgets to do assignments also. Could this be a sign of ADHD? Dr. Oshodi.
yes, it may be a sign of ADHD. You know, many a times children with ADHD may be in the classroom. They're looking everywhere. Someone coughs, they look. They don't write their notes. They are talking in the back of the class. They are passing papers to one another. They can be the heart of the classroom. Everybody rallies around them because they can be fun and busy, but then their schoolwork may suffer. Some of them find it hard to complete notes, but they may be that child that they're the ones that you ask questions and they will answer the question. I've seen such children. The teacher will be like, if not that this child answers any question I ask him in class, this child must repeat, because he never writes notes. He doesn't do what he's supposed to do, but he always answers. It's almost like they have a photographic memory. Some of them are very auditory learners, and some can be visual learners. But you know, unfortunately, our educational system is very fixed on writing and completing tasks and all that. So that's why being in a school where you can motivate for support for your child, that child may require a bit more time to complete their tasks, may need a bit more time to complete their exams. That child may have to have, you know, and these are what special classes would do. If a child is in a special class that understands ADHD, they may put these children, they write their exams separately. They give them a bit more time because they know that within the normal time, not that they're not brilliant, some of them can be really smart, but they're looking at everything but the work in between. And they will be wrongly graded and failed. So as you're searching for schools, you need to think about what kind of support does the school offer. And there are some schools that are really trying in Lagos. They are not perfect. They have their own shortcomings. They may be expensive. Some may be, you know, whatever, but there are options. So you need to find out, okay, how would they support a child that is struggling with hyperactivity or inattention or difficult, and some of them have difficulty writing. They have coordination skills challenges. That's why their handwritings are so bad most times. In fact, when you check them during assessments, if a pediatric neurologist assesses the child, say around 5 or 6, they may find out that their fine skills are delayed. They are not very coordinated. They're a bit, you know, what's the word, unsteady. You know, it could be with their writing, it could be with their gait, you know, they're just everywhere. You know, so like I said, understanding is 30% of the problem. You're getting solution because you can begin to read more, do a lot. You can, for example, even that writing, you can go online and check, how do I help my child, you know, improve their writing? And begin to be that intentional parent that is not just, you're so lazy. It's not laziness, please. It's like saying someone that cannot see the blackboard because they're not wearing glasses are lazy. And each time you say that, what you're doing is you're damaging the self-esteem of that child. So your child may be different, and it's okay to be different. That child may well be a genius sitting in your home. If you can just mind those things and help with those challenges a bit more and not let out your own frustrations, which we empathize with, but getting the best out of that child is your main assignment. Thank you.
Absolutely. Thank you so much. So we are moving on to the next WhatsApp group, the event group 2. And there's a question here from McCarthy Agbo. She said, my son is 6 years old. Though he talks well now, but didn't start speaking well until he was 3 to 4 years. He still finds it difficult understanding some things. Also, he still poos on himself. Even at 6 years, he knows he wants to poo, but will not go or say he wants to use the toilet. He will hide and do it on himself. My husband says he's fine and should not take, we should not take him to the hospital, but I'm worried. Could this be a part of ADHD? Dr. Omotosho.
All right, so I just typed in the chat room right now that for that child in question, you would notice that generally my responses are about solutions. So regardless of the label, it's about, for me, the solution. So for that child, PECS can help. PECS is simply Picture Exchange Communication System, which is
we can't see
a child
you,
who can talk. Let the child use pictures. You've mentioned, for instance, that this child knows when he wants to poop.
There you go. We can see you now. Go ahead, please. I couldn't see you for a moment, please. Go ahead, please. Can you hear me? Go ahead, please.
All right, okay. So for this child in question, PECS may just help. And I've dropped that in the chat room as well. That's picture exchange communication system. So if the child can't communicate by speaking yet, while the child is receiving speech and language therapy, you can also have pictures of the most basic things, and you can put those on the wall. For instance, you can have a picture of I'm thirsty, being somebody drinking water, or I'm hungry, or I need to poo, or I need to ease myself, those kinds of pictures, and then you put it on the wall. So when the child is trying to communicate something, you can take the child to the wall, and then the child would then point to the one they're trying to say. And as they're pointing to it, as the parent, you're also reiterating that thing. You're saying it so they continue to hear it. And then you're working hand in hand with the speech therapist to make sure that the child progressively gets better. This is one of the different questions I've seen in the chat room related to the speech of children in the context of autism, ADHD,
dyslexia,
isolated speech delay.
Awesome. So I think this will be our last question, okay, for the evening. We have a question from Mr. Richard, and I think this is a very interesting one. His name is Rich in the WhatsApp chat, but you guys should keep sending your questions, okay? Don't stop, because we do have a platform to engage you. So we have something for you at the end of the class, so just hang in there. So Mr. Rich, as his name is labeled on WhatsApp, asks, my son was speaking prior to COVID, but degenerated in his speech during the lockdown. He became hyperactive and was later diagnosed with ADHD. He's currently undergoing therapy and mutters some words like daddy. I hope he will begin to regain his speech again. He was speaking prior to the COVID lockdown, but degenerated in his speech during the lockdown. He became hyperactive and was later diagnosed. He is currently undergoing, okay, he repeated himself. So his question is, I hope he will regain his speech again. Unfortunately, he did not mention how old his son is. But Dr. Oshodi, do you have anything to say to Mr. Rich?
Well, thank you, Mr. Rich, for that question. And I'm glad Dr. Jules mentioned it will have helped us to have an idea of the age of this child to be able to guide. But it sounds like it's a young child. It sounds like the child is young. Child had acquired some language, and then during the pandemic, lost the language. The pandemic was hard for all of us, in different ways, and there were children who needed the social experience that schools offer. And unfortunately, they were disrupted out of that. Because going to school is not just to go and learn 1 + 1, 2, and they're learning things in social interaction. So exactly, the child is 4 years old. Thank you, Mr. Richard. So this child is a young child. Acquired a bit, COVID pandemic was 2 years ago. So this child was probably maybe over 2 then, almost 3, between 2 and 4. So the fact that when children go to school, they're talking with one another, they're picking language, they're picking words. That's why you may find a child go to school and come back with words. You'd be like, who taught you that one? It's in school. Something that they're saying in school. So a lot of learning is going on. So that disruption could have affected this child clearly. Then the other thing is, at times, there are certain conditions that could also mimic exactly this. For example, autism spectrum disorder. Sorry to sound like I'm scary. I'm not trying to scare you. It's just to be aware. Remember what I said, being aware is 30% of our help we're getting. There are some children that would acquire language and lose the language and lose some of the skills they've acquired before. And it may be part of the presentation of autism spectrum disorder. It doesn't sound like he had completely acquired language, but he had some words, but he now lost them. But it seems like he's also picking. So I must appreciate Mr. Richard. Well done. You're on the right path, getting him into some form of therapy, speech therapy. It may not be ADHD, or it may be ADHD and autism, okay? And it may well be just autism, but you need someone to evaluate and guide so that a little bit of the more specific support systems for each condition, you can now intentionally seek those out, okay? Beyond just all these general things that we have said. But well done, you're in the general right direction, and it's nice that you're an observant parent, indeed an observant dad, which must be commended. Many dads don't even, may not even understand these fine details around this. So please, consider getting him evaluated so that you may have a clear idea of what's going on. Thank you.
Wow. Thank you so much. Please, let's appreciate our speakers this evening. Thank you, Dr. Yewande Oshodi. That was fantastic. We got questions too from people saying they're in Abuja. They would like to see a specialist. We'll be able to help you guys out. Thank you, Dr. Ayotunde Omotosho. You guys did amazing. Thank you so much for the presentation. I'm sure everybody here can confidently say they learned something that would impact their lives very, very positively, and they can go on to be advocates after tonight's presentation. We want to call up, don't go anywhere. We're just looking for some of our representatives to talk to you, because this program was brought to you, like we said, by, Lagos State, Ministry of Health. We have, the NGO Mind Trust. We also have supporters like Jensen Pharmaceuticals, okay, in the house, and the Association of Child and Adolescent Psychiatrists and Allied Professionals of Nigeria. I hope I got that right. Yes, because I'm still trying to sift through to see if our representative is here. Is she here? Dr. Omotosho, can you see her handle? I can't see her. I'm trying to pull up. Okay. Yes. So I'm trying to see, okay, are you here? You can raise up your hand if you are here.
All right, what's her name? So I can also try to find her.
Okay, Idahosa.
Oh, okay.
Idahosa. Let me see if I can put the hands down. Maybe that would help. I hope she's here. Let me search WhatsApp real quick.
I'm also searching at the moment. I'm yet to find her.
Okay.
I don't think she's here. I just searched and I can't seem to find, or maybe she's here with another name.
Yes, so if you can contact me on WhatsApp to know the name you used. While we are doing that, I want to give every single one of you here an assignment, okay? I think the best way for you to say thank you to all of us for putting this together, ADHD Awareness Series, is to give you something like a take home, okay? I'm sure you must have gotten a lot of value from tonight's series, okay? Tonight's episode. So what I'm going to do is I'm going to share something on the screen. This is your assignment, okay? I'll share something on the screen. You take a screenshot of that, and then I'll put up the picture of everybody, gallery view. I know on laptop you can see it, but probably if you're on your phone, you can slide. I want you to also take a screenshot of the attendance. And there are two things that I want you to do with that information, okay? So this is the first one. Can you see this banner? If you can see my banner, type a Y. Y for yes. In short, if you can see my banner, type ADHD. ADHD, ADHD. I want you to get used to that. Good. Now, I want you to understand that at the end of today's series, after 2 beautiful days of awareness, You are now an advocate for ADHD awareness. You are the voice, okay? Take a screenshot of this picture. So pay attention, okay? Take a screenshot of this picture. And we want you to put it on all of your social media platforms using the following hashtags. So you're going to put hashtag, because let me tell you what happens when you put a hashtag, right? When you put a hashtag ADHD Awareness Series, when I put it up on social media, I can locate you. Dr. Omotosho can locate you. Dr. Oshodi can locate you, okay? You're going to use these 4 hashtags: ADHD Awareness Series. Don't judge. That is our message, because we don't want you to judge that child. We don't want you to judge any individual that is dealing with ADHD. You have to be empathetic. You have to become that ambassador of how to relate properly to children, even adults, about the message, okay? Then you use the hashtag seek help. Oh, I need to edit that. Oh my goodness. I need to edit that, guys. I just saw an error. It's not seek hope. It is seek help. And I'll just take a second to rectify that. It's very important, because the moment we leave here, I don't want our work. What we need to do is make sure we create a ripple effect. And you guys are such, I don't think I've seen our audience as awesome, as active, as interactive as you guys. You guys are just so awesome. So I want to make sure you don't end this journey here. You have to take this journey with you on every single platform you find yourself, because internationally, it also gives you recognition when you do that, okay? So we want to really continue this journey with you. So hang on while I put up the other screen. Let me see if you can see me now. Good. I want to put up the new picture. Good. So if you can see my screen, type or Y. Good. So you have to scrap the old one. Let's use this one. You have to scrap the old one. Seek help. Yes. So I want you to type in the chat, don't judge, hashtag don't judge. Remember, don't has an apostrophe at the top after N. Type in hashtag don't judge, don't judge, don't judge. Then type in hashtag seek help. If you can type in all the 3, it means that we are communicating. Good, thank you. It has to be one word, so no space in between don't judge. No space in between don't judge. Put it together. Hashtag, beautiful. Thank you so much, Bumi. Don't judge, seek help. Hashtag 8, beautiful. You guys are awesome. I knew that you guys are just too much. So take a screenshot of this picture, put it on social media. I'm going to put a gallery view of every single one of us. Make sure you take a picture of the class, because I want to celebrate you. Dr. Omotosho wants to celebrate you. Dr. Oshodi wants to celebrate you. I want to be able to locate you and celebrate you and say, yes, this person was in the class. You are an ambassador. Yes. Ajibade, don't put the seek help together with don't judge. Don't judge is together with a hashtag, and then seek help is together, separate. Yes, ADHD is separate. ADHD Awareness Series, separate. So 4 of them. Take a screenshot right now of this picture so that you don't forget. You can write it in the same way. We want to celebrate all our ambassadors. Congratulations, you guys are absolutely awesome. Make sure you register on the website www.checkadhd.org. We want to keep helping you, want to keep connecting with you. This is not over. It's not over here. We keep going, we keep going, we keep doing this. That is what we do. Yes, so I congratulate every single one of you. So are you ready to take a picture? Let's see everybody's faces. Put on your video, put on your video. I see Matthew Olufade. Thank you so much for being here. Thank you guys. You guys are awesome. Thank you so much for all your questions, all your support. We really appreciate you. We want to see your faces of the ambassadors. You might see me, I might post your picture. So please put it up, put it up, put it up. Want to see you, want to see you. Yes, I see you, Haminat. Please smile, oh. You're an ambassador, you have to smile now. Nketi Emmanuel, wait, are we quarreling? Smile, Veronica, thank you so much. I see your beautiful faces. Thank you. I want to connect with you on social media. Abuge, I hope that is how, I don't know, is that the way they pronounce it? I see you, Victoria Lawrence. Thank you so much. Who is screen sharing? Oh, I hope somebody is not. We have to disable that. Please don't spoil the vibe. Who is doing that? Who is doing that?
I suggest you just disable screen share.
Yes, I want to do that now. I've done that. Thank you so much. Yes, thank you so much. I see you, Maureen. I see you, Ego. Thank you, Joy Olania. Thank you, Olutobi. Thank you, Emeka Odom. I see you, Kayode Abobari. I hope I did not destroy your name. So just wave bye-bye. I see you all. You all look so beautiful. Thank you so much. Don't judge, seek help. Isioma, I see you are looking so beautiful. Yes, I love those red lipsticks. Thank you. I see Omo Bola. Why are you using emoji now? I see all of you. Thank you, brave individuals. If you are here, Stella Anucha, I see you. If you are here, Joy, I see you moving around in your green room. Thank you. You guys are beautiful. You are wonderful. Priska Umosu, I see you. You are beautiful. Toby, thank you. Hakim Odusonya, thank you. Beautiful smiles all over the place. Remember, you guys, we need to get the word out there. Let people know that there's something like this. The labeling of these kids is so not fair. So just imagine if Toby Amusa was labeled and was shunned on and was punished and was silenced. We would not have her representing our country today. Is that not scary? We really need, this is something that deserves, I can't think of any other thing that deserves more voice than ADHD, attention deficit hyperactivity disorder. We have to help the kids. They can soar, they can excel. You can be that person that would make a difference. I look forward to seeing every single one of you online, okay? Use the hashtag. I'm going right now to check on you guys. So bye. Let me see if I can unmute and hear your voices as we close. Can I do that? Can I achieve that? You can say thank you.
Doctor. Thank you so much.
Thank you.
Thank you, Doctor.
God bless you.
Thank you so much.
Bye-bye.
So much. Fantastic. Thank you. Thank you.
Bye.
Bye.
See you again.
Good night, everybody. God bless you. Bye. Good night, everyone.
Good night.
Oh, the kids, see all the Mohammed. Thank you. Thank you for all the emojis. More emojis, more emojis. Let me see. Kayola. Thank you.
Take one now. Take one.
Thank you. Yes.
This one, go check.
Thank you so much.
Brush.
Which one do you want?
Social media. Tag the button. Make this trending. ADHD Awareness Series. Okay. Don't judge. Seek help.
Don't judge, seek help.
Don't judge, seek help. ADHD.
Hashtag ADHD.
Yes, I love that people saying that.
Why did you do?
Thank you.
Don't judge, seek help.
Help. Don't judge, seek help. ADHD Awareness Series. Yes, that's our message. God bless you. We'll see you on the WhatsApp platform. Night rest.
Sorry, Dami.
Take. Open this thing down.